All right, so this is an example of portions of a shoulder treatment. We just went with a couple of needles here for demonstration purposes, but even in the few needles that we have here, we're going to get a lot of changes in what's going on with him neurologically. So our intent here is pretty much to neuromodulate whatever's going on in the shoulder and whatever might be inhibited. So for example, here, as you can see, there's very good muscular contraction here. I went with a 2-line technique in his infraspinatus here and in his teres minor here, which are two really important, not only external rotators, but they're really important in the overall stability of the shoulder in itself, because they're external rotators on their own, but from a functional standpoint, they help to bring the humeral head closer into its socket, which creates more stability in the entire shoulder, limiting injury, increasing the functionality of the shoulder. With this point here, I went a little bit closer to the musculotendinous junction of the infraspinatus. So I have a lot of focus on his external rotators right in through here. Up here is a really good point, because what we're doing here is I'm going through the deltoid muscle, which means that I'm impacting his axillary nerve, which innervates the entire deltoid as a whole. So neurologically I'm affecting him, but it's also deep enough that I'm into the shoulder capsule. And the capsule of the shoulder is really important for the entire proprioception and functionality of the shoulder. So other points that I would incorporate is points right along here, along the midline. That would allow us to impact the perfusion of blood flow to the entire upper extremity in itself, but also to the intended target, which is this shoulder. So with that in itself, here we're modulating muscles, we're modulating the neurological system, and then we're going to be able to impact and elicit changes. A lot of that will show up when we reassess, but the biggest gains from this is going to be when Carlo comes in for a follow-up visit and we get to talk about, you know, how things fired while he was training, because if it doesn't change in a functional standpoint, then we're not going to really make too much progress. So whatever we assess here, he needs to be able to utilize that, and it has to be able to change in the way that he trains. So most of the needling process is completely painless. This one up here Carlo felt a little bit of a dull ache, as he could probably attest to. With the dull ache, it's because I'm going right down into the shoulder capsule. But again, it all depends on patient comfort, right? No points would be utilized, or no needles would go deep enough to a point where the patient is feeling uncomfortable, right? I'm always going to be working with patient's comfort level. So again, our focus here is to regulate and upregulate inhibited muscles, because I don't want to go chasing the pain. I want to chase muscles that, from a functional standpoint, seem like they need to be restored. So the needles will typically stay in for approximately 8 to 12 minutes, right? It all depends. A lot of the times with a initial treatment or the first time treatment with acupuncture needles, just to get the patient more used to what the needles feel like, I might not even go with the electricity. So at this point, I've taken the needles out of Carlo. Taking the needles out is painless as well. All the needles are one-time use. So right now at this point, I'm just cleaning up a little bit of the posterior capsule, or the back of Carlo's shoulder capsule. Again, this is just a little bit of manual treatment. I'm just going through any lines of tension I feel in the capsule in itself. If we have restrictions through the capsule, that can affect the overall mechanics of the shoulder. I'm just going through a couple of passes here just so you can see what the manual or hands-on treatment looks like, because this is a very integral part of treatment overall as well. After I go through this right here, we're going to sit Carlo up and we're going to retest and see what the functionality is like at that point. Alright, so we just finished up with a little mini demonstration treatment there, and just with that treatment in itself, let's see what changes we find here. So I'm going to muscle test exactly what I muscle tested week last time. Go ahead and push back towards me. Push, 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 push. Good, relax. This side up here, hold up, push back towards me, push, 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 push. And as you can see, like, I'm sitting on Carlo's arm now, and I'm not able to move it like I was initially, right? So there's a lot of neurological changes that just happened there, and just because of his ability to stabilize the shoulder better now, it's going to help his overall mechanics, and a lot of those muscles that weren't able to fire at full potential will be able to kind of get back into the game now, so that everything's more evened up. It's those imbalances that will typically initially cause injury. So let's check his external rotators here now. Gonna push back towards me, push back, push, 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 push. Like, I'm sitting on Carlo right now, putting pretty much my entire body weight on him, and we got a lot more activity. That I was I was expecting to see, because I went directly to his external rotators, because that was really important in what we found initially. So again, at a follow-up visit, Carl will come back, tell me how things were from a training and functional standpoint. In conjunction with that and the manual treatment, we have nothing unless we have exercises as well to pretty much stabilize and move forward with what we've been doing here. So a lot of things that we'll be doing is going to have to do with stability and motor control of the scapula. So things like landmine presses will be really important. Bottoms up kettlebell walks, all of these things to keep the shoulder compact, but to also challenge the stabilizer of the entire shoulder girdle. So let's see how that goes. Let me know. All right?
Thanks, man.
No problem. Thanks for tuning in with us today, guys. That was a demonstration on an acupuncture treatment. If you have any questions at all, don't be afraid to stop by the office, ask us any questions you'd like. Get through a consult. We could talk a little bit more about what acupuncture could do for you.
Thank you very much, guys, for watching. Always remember, pay attention to your body, right? You never know what's really happening until you actually take a look and really see for yourself, okay, am I really feeling the contraction on one side? Is one side growing bigger than the other side, right? That's when you know there's a problem and you should get it checked, you know? So, like I said, thank you, Kevin.
No problem.
Once again, we're Strength Nu Therapy. Give us a call, contact us if you have any questions. Thanks, guys.
Keep training hard, keep moving well, guys. See you soon.